Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Smith. Your primary physician has referred you to me due to a potential issue with acid reflux or a related problem.
Yes, that's correct.
Okay, can you provide some context for me?
It's been happening for a while now. I often experience heartburn after eating, which I'd been managing with over-the-counter antacids. However, around 6 months ago, the issue became more severe, and I noticed other complications. Symptoms are somewhat inconsistent, but the predominant issue seems to be regurgitation.
I see.
And there's more to it than just that. Occasionally, I've been having trouble swallowing, but this doesn't happen regularly. Previously, I had experienced bouts of diarrhea, but now it's more like I have constipation. The inconsistency of these symptoms is driving me crazy. It's like walking on eggshells, not knowing what will happen next.
Did you have any other symptoms not directly related to your digestion?
Yes, I do have a recurring skin rash. It gets worse during episodes of acid reflux. Plus, I've noticed I get migraines around the same time as my digestive issues. It's a weird correlation, and initially, I didn't think they were related.
Have you identified anything that exacerbates your symptoms?
I work as a software engineer, and my job is pretty stressful. Currently, the company is downsizing, and I'm unsure about my job security, which is causing me quite a bit of anxiety. I'm not sure if this has anything to do with my symptoms, but I thought I should mention it.
How does this condition impact your life most significantly?
Well, it's constantly on my mind unless I'm really focused on something else. It's exhausting, you know. I always feel drained and don't have the energy to do anything after work. I go to bed tired but struggle to sleep due to my acid reflux. I wouldn't say I'm depressed, but dealing with this can get me down.
I see, and it appears you've been considering your diet as a possible factor. Can you share more about that?
I consulted a nutritionist who suggested that my acid reflux could be due to a lack of certain nutrients in my diet. But I eat quite healthily. I did try to increase my water intake and cut down on dairy, as the nutritionist suggested. However, I'm not sure if that's made much of a difference. I also minimized my caffeine intake, and I've had food allergy tests, but they didn't reveal anything significant.
Have you tried any medications?
Yes, I was prescribed a proton pump inhibitor by my GP to reduce stomach acid. But honestly, I'm not sure it's helping that much.
Have you tried any other medications?
Well, my doctor also gave me antidepressants. I'm not entirely sure why, though.
Antidepressants can help manage the communication between the nerves in your digestive system and calm down the muscles. Did you find this medication effective?
Yeah, it seemed to help a bit, I suppose.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Mrs. Walker. It's nice to meet you.
Hello, doctor.
Let's start by talking about your current situation. Can you tell me in your own words about the issues you've been facing and how they began?
Of course, call me Emily. It started 3 years ago when my wife and I moved into our new house. I was working as a warehouse supervisor, which involved heavy lifting.
I see.
I started feeling a sharp, persistent pain in my lower back. At first, I thought it was just fatigue, so I ignored it. But it got progressively worse. I sought help from a chiropractor thinking it might help.
Okay.
However, the adjustments the chiropractor made seemed to exacerbate the pain instead of alleviating it.
That's unfortunate.
Indeed. I then started using a heat belt, which gave me temporary relief.
I see, but it didn't completely solve the issue.
No. After a while, I started to experience a tugging sensation, almost like something was pulling my right leg upward.
Understood.
It was very uncomfortable and made it difficult to walk. A general practitioner I consulted suggested physical therapy, which I began right away. One day, the head physiotherapist looked at me and said, you know what your problem is, don't you? I was taken aback and said I didn't. He then diagnosed me with a condition called sciatica.
So what did you do next?
I was dumbfounded when he said there was no cure and I just have to manage it. I went home that day feeling hopeless.
I can understand your feelings.
He could have been a little more empathetic, I feel.
I'm truly sorry about your experience.
Thank you. After the diagnosis, I began researching what could be done to manage sciatica. I tried more chiropractic sessions, but they didn't help. I then started seeing neurologists, and was put on a medication called gabapentin, but it didn't really help either.
Yes, that wouldn't always help with your condition.
That's what I realized. The best thing I did during this time was joining a support group for sciatica patients. It was comforting to know that I wasn't alone. I purchased a specialized chair to alleviate the pain, which did provide some relief. I read about a new treatment involving epidural steroid injections at a university hospital, which seemed promising. So, I discussed it with my doctor, got a referral, and had my first injection in January.
How did that go?
Initially, the injections helped a lot with the pain and I was able to walk more comfortably.
That's good to hear.
However, it gave me some side effects like nausea and dizziness. Just when I thought I'd found a solution, the pain returned and I had to get another round of injections in June. The second round wasn't as effective. I ended up having 7 sessions and taking multiple oral medications, which I can't remember right now.
That's all right.
But nothing seemed to work long term. The side effects got worse, including memory issues. Eventually, they gave me a device for self-administered pain medication. Then, I read about a newer surgical treatment in my support group's newsletter, being performed by a local neurologist, which would be you. So, here I am.
We'll certainly do our best to assist you. I just need to ask a few more questions.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
You've had the implant in for a few minutes now. How does it feel?
It's not too bad. I was expecting it to hurt or feel weird, but I can't really feel it. My mouth feels a bit numb though.
That's normal, it's just a local anesthetic. In a few minutes, we'll test it with a little bit of pressure.
I was fine when you put it in, but I'm a bit nervous about you applying pressure. I'm afraid it might hurt.
That's unlikely. You'll just feel some mild discomfort.
The room looks a bit blurry though. I mean, I can't quite make out the clock on the wall.
All of them?
Just the small ones.
Let's give your vision a few more minutes to adjust.
Now look at question 26.
Robert, can you assist me with the patient in room 202? The man who had hip replacement surgery last week?
Yes, he's scheduled for his first post-op physio session today, isn't he? Is he struggling with the exercises? He seemed a bit hesitant when I saw him earlier.
Well, he's a bit overwhelmed, but he's managing. He's struggling with the walking exercises, though, and he's really anxious about it.
Well, that usually requires 2 of us for support and safety, so I'll definitely join you. Has the surgeon seen him yet? I know there were concerns about his progress and the level of swelling yesterday.
Yes, he's been given the green light for physiotherapy today, but I think he could use some reassurance.
Okay, let me just finish up here and then I'll come over.
Now look at question 27. One of our main goals is enhancing the patient experience during their hospital stay. We've recently started a program called Music for Healing, where we bring in musicians to perform in the common areas. Patients can enjoy some soothing live music, which has been shown to help with stress and anxiety. They're also encouraged to bring their families or talk to their loved ones over the phone and share the experience. The response so far has been incredibly positive. Patients have mentioned how much they've appreciated the program and how it makes their hospital stay a little more enjoyable. In fact, it's been such a success that we're planning to implement it across all the hospitals in our network. Now look at question 28.
I just got a consult request from the ER. They have a 45-year-old woman who came in with a sudden severe headache. They're suspecting a possible aneurysm and are requesting a CT angiogram.
Are we sure that's the best approach?
I was considering suggesting an MRI instead. It could provide similar information without exposing the patient to ionizing radiation.
Any concerns about using MRI instead of CT? Like, say, the sensitivity or specificity.
The MRI is just as effective, if not more so, in detecting aneurysms. So, I'm confident in the results.
Okay. That also means we can avoid using contrast dye. But what if the MRI doesn't give us a clear picture?
In the unlikely event that the MRI is inconclusive, we could then consider a CT angiogram.
Sounds like a good plan. Let's notify the ER about our recommendation.
Now look at question 29.
Alright, next up is Mrs. Rodriguez's bypass surgery. Are there any concerns from anesthesia?
She's generally in good health, except for her asthma, which is well managed. She's overweight with a BMI of 32, but
Will we need the bariatric operating table?
that should not be necessary.
And how about her asthma management postoperatively?
She'll continue her inhalers and we can use nebulizer treatments if needed.
I remember she experienced significant pain following her last surgery, and this procedure is more invasive. We might want to consider an epidural. Her pain tolerance seems quite low.
Now look at question 30.
We're examining ways to enhance the efficacy of health and healthcare systems across the United States. One strategy we're considering is the introduction of interprofessional, community healthcare teams. These are comprised of professionals from various fields working together to provide holistic services, including healthcare, social services, and lifestyle guidance, to patients within their community. There's evidence to suggest that such teams can have a positive impact on the management of chronic conditions, including obesity, COPD, and diabetes, as well as mental health issues. There's also data to suggest potential improvements in patient engagement and care coordination. At present, it's not entirely clear how these teams could impact healthcare costs in these areas, but our research aims to clarify this while also addressing the practicalities of implementation and evaluation.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. My name is Lisa Ferguson, and I am a certified diabetes educator nurse, aiding individuals in understanding and managing their diabetes. Today, I will shed light on my work, focusing on a specific case study, let's name him Tim, to illustrate the variety of situations I encounter in my practice. But before we dive into Tim's case, let's grasp some background information. Diabetes is a long-term medical condition that affects approximately 4.7 million people in the UK, and it's rising every year. This condition occurs when your blood glucose, or sugar, is too high. And while it may sound simple, uncontrolled diabetes can lead to a host of complications, such as heart disease, kidney damage, and even blindness. The condition is complex and involves many factors, which is where my job comes into play. It's my role to educate patients about their condition, including how to monitor their blood glucose levels, adhere to their medications, and make dietary and lifestyle changes. Now, let's delve into the specifics with Tim's story. Tim, a middle-aged man, was diagnosed with type 2 diabetes during a regular health check at his GP surgery. Despite experiencing symptoms like increased thirst and frequent urination, Tim chalked them up to stress and aging, overlooking the potential underlying cause. However, his blood test showed an elevated HbA1c level, a clear indication of diabetes. His visit to our diabetes clinic began with a series of tests, confirming his elevated HbA1c and high fasting glucose levels. We then discussed his diet, lifestyle, and medical history. Tim admitted that he was a smoker and did not maintain a balanced diet. As a nurse, it's my role to explain to patients like Tim about the necessity of a healthier lifestyle and the risks associated with continued unhealthy habits. Tim's diagnosis hit him hard. Despite having researched his symptoms online and suspecting he might have diabetes, hearing the formal diagnosis was an emotional blow. It was at this point where I met him, vulnerable, confused, and in need of a guiding hand. People's reactions to a diabetes diagnosis vary widely. Some, like Tim, are initially overwhelmed. Others, particularly those without severe symptoms, might underestimate the importance of adhering to their medication and lifestyle changes. This nonchalance can be dangerous, as neglecting the disease can lead to severe complications such as cardiovascular disease or kidney failure. Moreover, patients often face difficulty in making the necessary dietary and lifestyle adjustments and maintaining their treatment regimen. This situation underlines the significance of diabetes self-management education, DSME, and support services, such as the ones we run. In these programs, patients are given practical skills and knowledge to manage their condition effectively. They also provide an opportunity to discuss their concerns and challenges, thus allowing us to provide individualized advice and solutions. Although empirical evidence is still limited, our team feels these community clinics provide more comprehensive care to our patients, as opposed to a brief hospital visit. Our goal is to have more of these specialized services available to help more individuals effectively manage their diabetes. Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good day everyone, I'm Dr. John Anderson, a cardiologist with a particular interest in the rise of sedentary lifestyle-related heart diseases, and issue experts are beginning to dub the silent killer. When we think of dangerous behaviors, we often picture smoking, drinking excessively, or even illegal drug use. However, the picture of an individual leading a sedentary lifestyle is less striking, yet equally concerning. The risk group for this issue is vast, encompassing all ages, professions, and social classes. Most people who engage in prolonged sedentary behavior do not do so out of addiction but rather convenience or societal norms, which makes addressing this issue quite challenging. In recent years, there's been a dramatic rise in sedentary behaviors. More people are engaging in occupations that require little to no physical activity, and leisure time is often spent in front of screens. Our quick fixes to this have been encouraging gym memberships or implementing wellness programs, but these solutions often do not fully address the depth of the problem. A more comprehensive, personalized approach to physical activity is needed, one that takes into account the individual's lifestyle, preferences, and capabilities. People generally understand the concept of a healthy lifestyle, but the practicalities can often be daunting or misunderstood. While cardiovascular diseases have been a focus of medical education and public health campaigns, there is a need for more nuanced understanding and strategies to tackle sedentary behaviors. Just as we individualize treatment plans for conditions like hypertension or diabetes, we need to craft personalized lifestyle interventions that are both practical and sustainable. It's not just about promoting exercise or reducing screen time. We also need to address other lifestyle aspects that contribute to sedentary behaviors, like diet and sleep. Often, people underestimate the role of these factors in their overall health. Overconsumption of processed food and inadequate sleep not only contribute to health problems directly but also encourage a sedentary lifestyle by affecting energy levels and motivation. We need a multidimensional approach to address this. Let's take a case of one of my patients, a 40-year-old man, let's call him Paul. He was a software engineer with a high-stress job that required him to sit in front of a computer for extended periods. He had become overweight and developed high blood pressure, which, over time, led to heart disease. Like many in his position, Paul had initially dismissed the severity of his condition, believing he was too young for heart disease. Unfortunately, this is a common misconception. Today, Paul is doing much better. He sought help and started a tailored plan to address his sedentary behaviors. His journey wasn't easy, it required a complete overhaul of his lifestyle, not just a few trips to the gym. He had to modify his diet, sleep habits, and work-life balance, as well as incorporate physical activity into his routine. His story is a stark reminder of the significant impact of lifestyle changes on heart disease. To prevent these conditions from occurring, we must remember that a healthy lifestyle is the cornerstone. Health professionals should encourage patients to be active and should prescribe personalized physical activity regimens. At the same time, patients must be made aware of the risks of sedentary lifestyles and, more importantly, of the strategies available to combat it. We are all responsible for addressing the rise of sedentary behaviors and its impact on heart health. As health professionals, we need to recognize this silent killer and educate our patients, our communities, and ourselves to promote healthier lifestyles. As individuals, we need to acknowledge the role of lifestyle in our health and take proactive steps to lead more active lives. After all, in this battle against the silent killer, prevention is indeed the best cure.